Hello. We're talking about syndromes affecting the sciatic and femoral nerves. Sciatic nerve, also called sciatic nerve, is a large nerve in human and other vertebral animals, which is the largest branch of the sacral plexus and runs alongside the hip joint and down the lower limb. It's the longest and widest single nerve in the human body, going from the top of the leg to the foot and the posterior aspect. The sciatic nerve has no continuous branches for the thigh. This nerve provides the connection to the nervous system for the skin of the lateral leg and the whole foot, the muscle of the back of the thigh, and those of the leg and foot is derived from spinal nerve, lumbar 4 to the sacral third. It contains fiber from both the anterior and posterior division of the lumbosacral plexus, scatia. Sciatica refer to pain that radiates along the path of the sciatic nerve, which branch from the lower back through your hip and buttocks and down each leg. A typical sciatic affects only one side of your body. Biriformis syndrome is a condition which is believed to result from compression of the sciatic nerve by the piriformis muscle. Symptoms may include pain and numbness in the buttocks and down the leg. Often the symptoms are worsened with the sitting or running. Causes of Biriformis syndrome. Causes may include trauma to the gluteal muscle, a spasm of the piriformis muscle, anatomical variation, or an overuse injury. Few causes in athletics, however, have been described. Diagnosis is difficult as there is no definitive test. A number of physical exam can be supportive. Medical imaging is typically normal. Other conditions that may present similarly include a herniated disc. Treatment of Biriformis syndrome. Treatment may include avoiding activities that cause symptoms, scratching, physiotherapy, and medication, such as NSAIDs, steroid, or botulinum toxin. Injection may be used in these who don't improve. Surgery is not typically recommended. The frequency of condition is unknown, with the different group arguing it's more or less common. Femur nerve. The femur nerve is nerve in thigh that supplies skin on the upper thigh and inner leg, and the muscle that extend the knee. The femoral nerve is the major nerve supplying the anterior compartment of the thigh. It's the large branch of the lumbar plexus and arise from the dorsal division of the ventral rami of the second, third, and fourth lumbar nerve. Femoral neuropathy. Femoral neuropathy, also called femoral nerve dysfunction, is one possible cause of movement and sensations problems in the legs. Femoral neuropathy occurs when something affects the femur nerve, which starts in the pelvis. and goes all the way down the leg. The femoral nerve help you leg and move and give sensation to the front of the leg. Femoral neuropathy usually affects just one nerve, a condition known as mononeuropathy. Conditions that cause damage to multiple nerve can also cause femoral neuropathy, among other nerve issues. Symptoms of femoral neuropathy. The main symptoms of the femoral neuropathy are pain, burning, tingling, and reduced sensation or numbness in the leg. You may also experience weakness in the affected leg. For example, it may buckle suddenly, or we may have trouble going a flight or sitting. What causes femoral neuropathy? Potential causes of femoral neuropathy include an injury, excessive pressure on the nerve, something pressing on the nerve, such as a tumor or other growth. In injuries, a femoral nerve can be caused by a fractured pelvis, catheter procedure in the femoral artery, internal bleeding in the pelvis, wearing belts that are too tight, laying in the lithotomy position, similar to the common position used for birth, on your back with your leg built 90 degrees. What is Margilla pathetics? Margalia bracetics, also known as Hard-Roth syndrome, is a type of femoral nerve dysfunction that affects the lateral femoral calcaneus nerve. This portion of the femoral nerve gives sensation and feeling to the skin of your thigh. The symptoms of the myalgia beatiatics include burning, tingling, or numbness, especially on the skin of the thigh. These symptoms are more elevated on the outer side of the thigh with this condition. This type of femoral neuropathy is usually caused by repeated leg motion, hip injuries, weight gain, or wearing your belt too tight. Femoral neuropathy treatment. The treatment for femoral neuropathy depends on the cause. If there is an immediate cause, like a pelvic injury, your doctor will address that first. They may prescribe medication or other treatment for pain relief. Your doctor may recommend physical therapy or splits or other assistive devices to make walk easier and safer. If you have a tumor or other type of growth causing compressive of the nerve, your doctor may recommend surgery to remove it and relieve the pressure. If your femoral neuropathy is caused by excess weight or diabetes, doctor will help you to manage lifestyle factors. Losing weight can improve some cause of this condition. And thank you for your attention.